And that's really what we're trying to do, is get you out into the community and talking more about what you go through, sharing it with other people, and then bringing them in and getting to know them more, so that they can feel what, you know, we feel when we come here every month. We do have meetings occasionally in between on our monthly fourth Wednesday. We usually will put one in the second Wednesday of every month. Same bat time, same bat station, just on the second Wednesday instead of the fourth. So those are reserved for speaker days, guest speakers, somebody who wants to come in and, you know, if you've got a product you want to talk to everybody about, you can come in on that second Wednesday, and we put out the meeting request to everybody, and they can RSVP. And he has an idea of who's coming and how to prepare. And it turns out really, really good to work out that day, because everybody can remember it's a Wednesday and then it's the same time. Because we're all foggy, including me. I have fibromyalgia. I don't have autoimmune diseases, but I do have FM in its purest form, so I do understand everything that you're going through. I do have secondary overlapping conditions like degenerative disc disease and IBS, severe anxiety and depression, migraines, things of that nature. So I completely get what you guys are going through. So it might look like I have a lot of energy and really good at all this stuff on the website, but I go through what you go through, and this is done by volunteers. I just happen to have a really big mouth. And really, I do. I have a really big mouth, so it was really easy for me to come up here and, you know, yip yap like as you can see I really love to do. So I just happened to get thrown into that position. That, and you know, when I got diagnosed, that was like 7 years ago, I think. Oh, no, I take that back. It was about 5 years ago. 7 to 10 years ago was my first flare after I broke my leg in 3 places. Just snapped. You know, I was in the hospital for 10 days. And after that, it was just downhill from there. And it was a traumatic experience that triggered my FM. As many of you guys know, that's what starts. Turns on your DNA, whatever it is that turns that on. It was that particular moment on that it was a trampoline. I don't want to go through the details, let's just say it was horrifying. And that was the defining moment in my life that encouraged me to go out and find out why I was experiencing things on a more aggressive basis. And it took quite a while to get the diagnosis of fibromyalgia. I had no idea what it was. Nobody I knew what it was. And mind you, this was only 5 years ago. They were just about to come out with Lyrica as an approved medication. And I had no clue what it was. And I thought of myself as a pretty intelligent person. I did a lot of research. I spent a lot of time on the internet. How did I not know what that was? Well, I thought it was a death sentence. So I got online thinking I'll find information about it. And I did through the National Fibromyalgia Association. They were great, giving me the information that I need. But there was nobody to talk to in this area. I couldn't believe it. I was like, how can something they're claiming is so horrifying not available for support around here? I'm in Louisville, Kentucky, right? Why isn't there anybody here to talk to? I got sent to a doctor who threw Lyrica at me and said, you know, look it up online, Google it. I don't have enough time to give you the details. So when I couldn't find anybody, the most horrifying idea in my head was, who am I supposed to talk to? Fiji and I were clueless as to what was going to happen, what to do, where to turn. And so I was looking through the meetup pages, and I found some old groups that were no longer functional. One of them was that, is it Quakenessa? Is that how you say it? Quinepicin? Anybody know? Quakenessa? Whatever. It was that cold stuff you take when you got a cold. There was a group here that the number's still active, but they don't meet anymore. So I said, you know what? I'm just going to come up with this really funky name, and I'm going to make a date. I'm going to pay the $19. I'm going to show up at the Borders bookstore, sit in their coffee store, and see if anybody sees that book. Because there's so many members on Meetup, somebody out there has to be in this area that has FM, right? Nobody showed. And I thought, I came home, cried, and then I went back. I said, you know what, I'm going to make this a family event. Let's Tell them to bring their spouses and their friends instead of one-on-one. Maybe they don't want to come by themselves. If somebody showed up with their husband, and when BJ and I listened to them talk, we couldn't believe we were hearing the same words. And, you know, again, I cried after finding, you know, my diagnosis sounded horrifying. I called my mother, oh, I actually have a diagnosis, but I don't know what it is. Now it was like, I can't believe somebody showed up, I'm not alone, right? But that was just one person. So I kept it going. And, you know, there's never been a time nobody has shown up since then. Just that very first meeting. There might be just one person, or I might not have shown up and they showed up all by themselves, which, you know, never really happens, but in 4 years it's hard to believe I missed a meeting, but I have. And that particular one time, it was a snowstorm and it was ice. Well, it was only ice in a localized area, and it was here, or it was in Indiana, sorry. But it was not here. Well, we weren't going to risk leaving and coming across the bridge. But they showed up at Applebee's, and they sat in the booth, and they had a great meeting. It was a success. And so, to me, that meant people were dedicated to coming together, even if it was at Applebee's sitting in a booth. And it was really that moment that I thought, wow, they're willing to go out into the ice and the storm. And they said, well, there wasn't anything on the ground. We left. I thought, well, you know, I could have dreamt, you know, that horrifying. But she says to me, you know what? Even though you weren't there, we missed you, but it was a really great meeting. We sat all night long at Applebee's, and we talked all night, and we really got to know each other. And I wondered how many people out there were sitting down doing that. And that was when I vowed, I'm never shutting this thing down. I don't care if they're showing up at Applebee's and talking amongst themselves over dinner, I'm not shutting it down. It's not possible for somebody to be diagnosed with fibromyalgia and not know that we're all out here. How is that possible if I can make it possible by making him pay $19 a month? Right? Yeah, $20 a month is nothing, I thought, to make sure that a community came together for dinner somewhere. And it grew substantially, especially after we became members of the NFMCPA and were trained by the Leaders Against Pain Coalition. And after our website went up on Facebook, everybody just kind of doubled in size and attendance, and it's really taken off. And then when Dr. Baird came into play, it increased it again. We had another wave of people. And then when Baird left the picture, he really came out of the woodwork because Williams was funneling them all here and we're funneling them all there. So many of you guys know about us through Dr. Williams, but we've been here for 4 years. And we've been coming here religiously and very dedicated to coming no matter what we say or do. We're going to be here. Either that or that'll be there. One way or the other, we've decided there's $20 is not worth shutting everything down and just walking away from. Even if I'm cured, there's no reason for that. So you have somewhere to go. And everybody you know that you find out has chronic pain and fibromyalgia, you can tell them there is somewhere to go. It's a library, it's open. You can show up at 6 o'clock on the 4th Wednesday of every month. Nobody may be there, but you tell them, they'll open the door, you can go on it, and you can sit and talk all night. So I thank you for coming here because this is really meaningful to us to know that we reached you, to know that we have members that are still here 4 years later. That really means everything to BJ and I to know that it's making a difference. And all the hard work that we put into everything is bringing you guys together. And that you guys were able to talk and share your stories. And somebody says, wow, all those people has that same thing. I can't believe somebody else is trying to fight on the sarcoidosis. That was the first time I've heard somebody else say that they have that. And I've been here for 4 years. And I was trying to find out if that's what I had. So you'd be amazed at what you'd find out that you learn years later. Something as simple as that, you would think you would have heard everything by now, right? No. we hear new things all the time. And we want to keep hearing new things. We want to make sure that you feel comfortable talking about that, even though you don't think it's associated. It really is important. It is important to talk about something like that because the symptoms mimic FM very closely. And they're still trying to find out if FM, if where that comes from, your central nervous system, is causing that. The same thing that's causing your FM. That's important. We wouldn't have thought that 4 years ago because they didn't know it came from the central nervous system then. But it really is that important for her and I to sit down now and be able to say, wow, what did you go through to get that diagnosis? I've been trying for years to figure that out. My doctor's like, I don't know, go see this doctor, go see that doctor. Right? So I've been going through the same thing you're going through still to this day. And I will always meet new people and I will always hear new things, and so will you. And that's what's important. So feel free to raise your hand, talk amongst yourselves, talk out loud to everybody else because we want to hear your voices. We want to hear what you have to say. This is by no means ever such a closed group that you shouldn't feel like you cannot talk to people, because you can. And you say anything you'd like to say with the exception of I hate you and please leave, you know. Yeah.
Has anybody ever taken Devlin or L-methylfolate for fibromyalgia?
You'd have to ask that a lot louder because I
didn't hear the question.
Has anybody ever taken Devlin or L-methylfolate?
Devlin?
Devlin.
L-methyl.
It is L-methylfolate, but the brand name is Devlin.
Devlin for fibrofog?
Or for pain or for anything else. It's called a medical food. Has anybody else ever taken that or heard of it?
Is it DEPLIN?
Mm-hmm.
What's its primary use?
Well, when I stopped
Is
taking
that off-label use or?
You said it was a medical food?
it's a medical food, it's a pill, but it's called a medical food. And it's to increase serotonin. Or to increase the
Make your brain better, partner.
So it's
it's to increase
prescribed.
yes, it's a prescription, but it's to increase the
To make
neurotransmitters
your
in your
brain
brain.
better, partner.
Okay, it's supposed to increase the neurotransmitters in your brain, particularly serotonin. So
Medical food containing methylfolate, active form of a vitamin folate.
Is that a prescription or is
it
it
is a prescription. And I will tell you now, your insurance will not cover it.
Right.
It's
Are you
now
taking
available
it?
only in capsule
My
form.
doctor prescribed it. She gave me a 30-day sample, and then I went to get a prescription filled and know my insurance stuff. So now she's trying to talk my insurance into covering it.
How much is it without insurance?
The generic form of it,
Oh, it is generic?
there is a generic. The generic is $108 a month.
Is there a, one of the
Let's see.
copay cards on
You
there?
can get L-methylfolate over the counter.
It's level methylfolate acid.
L-methylfolate, like it is right there.
Is it a supplement?
Yeah.
But on the main website, is there one of the copay cards where it will offer the
Yeah.
discount?
Yeah,
Actually,
$80
right
a
here,
month.
saving option.
Yeah.
Direct Health specializes in pharmaceutical
Yeah,
services supporting
$48 a month. Yeah.
3 payments of $48.
Have you used it?
90 day supply paid in 3 monthly installments.
And how much do you take a day? How much, I mean, are you
It
supposed
comes either 7.5 or 15 milligram. But what I discovered though, when I was taking it, she gave it to me to increase the serotonin, which was to hopefully lower the pain and, you know, but what I discovered though, is it decreased the fibrofog. I mean, like massively.
It decreases it, is that what you're saying?
Yes, like the fibrofog got much, you know, I was much clearer.
Wow.
So, it was like, that's why I was wondering if anybody else had ever taken this or heard of this.
It's interesting though, today I was doing research on diabetic neuropathy, and there's another medical food that is also the folate, and I can't remember, it began with an M, Mantex or something like that, and it's $48 a month.
Yeah.
And it is also, but you have to have a prescription.
What was that called?
It begins with an M, I want to say Mantex, or type in diabetic neuropathy and medical food, or
Is this supposed to be like a natural
No, it's prescription.
thing?
It's prescription. You
Oh,
cannot
but
get
with
it, you
the,
cannot get it over the counter.
With the Deplin, what it is, the L-methylfolate, which is what Deplin
Uh-huh.
is
Mantex, there it is.
folate is it's one of the B vitamins.
Okay.
But to get to the L-methylfolate, it would have to break down the particular B vitamin like 7 times.
Mhm.
So it's one of the 7 broken down things of the B vitamin.
So I wonder if you, if you take the B vitamin daily, or,
This gives you
B
the purest-
complex.
Yeah, this gives you the purest form of it.
Okay.
Yeah, that's the part
It
that's
supports the
it.
blood vessel
Some things your
by
brain may
providing
block.
neuropathies and-
Yeah,
blood, some things
this
may not,
is
never
the
know.
way that it's supposed to reach the brain blood barrier or whatever.
One
That's
thing I
it.
learned from the doctor I went to in Southern California, something make one person feel better, make somebody feel opposite, worse. Some people don't do nothing, so
Right.
kind of gives you, I think, we'll all discover in the future that our illnesses are really maybe 8 different breakdowns.
Like,
Is
I'm
there
not,
anybody here who does not know the scientific definition of fibromyalgia or what causes it?
You explain it.
It is a genetic central nervous system disorder. And the last research we've seen that came out of Johns Hopkins University said it was an afferent processing disorder, the central nervous system, that causes fibromyalgia, as well as other things like neuropathy, peripheral neuropathy, things of that nature, a lot of nerve damage type of things, excitable nerves. So if you'd like some of that information that came out of that research, we do have that available for you. If you want to read the details, it's pretty extensive, in-depth, scientific, but it's there, without a doubt. You're seeing a lot of information coming out about blood tests and new medications, all based on this research, and now you're seeing a lot of information about nerves and nerve damage. You see the recent commercial on Lyrica that's now for diabetic neuropathy. That's because they all know that it's all coming from the same area, and that was what Lyrica originally did anyhow. So now they're just redoing the entire, almost the same scenes, just putting in a whole different diagnosis in there. So you'll start to see that a lot more often, and a lot more information coming out about nerve damage. It is, from what they understand, they did find the DNA codes or markers for this, meaning that it was genetic and something that you're born with, and it just typically gets triggered based on trauma. That raises your pain level, and somewhere along the line, the volume control in your brain, your central nervous system turns that volume control up when you're, in a serious traumatic incident, and then pops off that volume knob and throws it away. That's it. And it's not something it ever gives back.
It doesn't have to be like a car accident or anything like
It
that.
could be birth, it could be divorce.
Yeah, I mentioned
It could be,
California
right.
had sinus surgery. and she
Divorce.
was after that.
Yeah, sinus surgery.
It's Ruth. I had a doctor tell me that she thinks that there will be different types of fibro, that they're actually going to be able to break it into certain
Yes,
tendencies.
Dr. Claw actually in his presentation, after his research was published, he had mentioned something about 2 forms of fibromyalgia being neuropathic and peripheral. Based on what type of FM that you had, it had a great effect on how you reacted to your medications. The doctors say I have the peripheral form, and there's really only one medication that works well for that. So all the others really are meaningless. And but the neuropathic, I found there are a lot of more options for you, and a lot more things. So
What is the difference between neuropathic and peripheral?
I really couldn't tell you. I mean, that's more of a central nervous system scientific thing, and somebody coming out of a flare. To remember exactly what that is, I couldn't really tell you for sure. But
Is
I
that,
can
is that
Google
in
it.
the article? I mean, is that in the information
It is.
on the website?
The research article
Uh-huh.
discusses this in depth, and
How
I'd
do
be
you
happy to
spell
give you
this
another
in
Have
copy.
the neuropathic and the peripheral?
Pardon?
The difference between it, it's in there somewhere? The
Yes,
difference? Okay.
and also on our Facebook page, if you're not on there, you probably should if you're on Facebook. I have slides from his presentation and all of his individual slides that are not in his research article, but that he put up when he did this conference for all these physicians. He had up on the screen these slides that he was referring to. And I took shots of every single one of those slides and I put it in a PowerPoint and stuck it on our Facebook page.
Can you spell his, what is his name?
Dr. Claus, C-A-C-L-A-U-W. Yeah. C-L, and then Dr. Howard, and there were 3 doctors actually that did this paper out of the University of Michigan, Johns Hopkins University. It was really amazing research, really amazing information, treatment options, who to go to. Don't be surprised if you're going to start seeing your neurologist from now on rather than a rheumatologist. Somebody like me, I have no reason to go see a rheumatologist. I don't have RA, I don't have any autoimmune, and I have no inflammation. I have peripheral fibromyalgia. That's it. I have no reason to see anybody other than a pain management doctor or my neurologist. So, but somebody who has sarcoidosis is going to see a rheumatologist, hopefully somebody that treats FM at the same time.
Actually, they only want me to see the pulmonologist every time I've asked about, because it's, sarcoidosis is considered primarily a lung disease, pulmonal. And so the pulmonologist, I every time I ask my doctor about it, if I ask him any questions, he says, talk that over with the pulmonologist.
Really?
Yeah, so, and I'm supposed to go back and see him again next month, pulmo, so.
It's interesting because it also affects the lymphatic system. And you may be seeing an endocrinologist.
Yeah, well, that's what, I actually had a lymph node that, they did a biopsy on, that's
Right.
how they discovered the granuloma.
Hey, look, high five, my girl.
Yeah.
Lindsay, I got you there.
Yeah.
Who are you seeing for your neurologist?
I have Dr. Jeffrey Frank is my neurologist, but Dr. Todd Shanks is my neurosurgeon. And his latest thing is, Dr. Todd Shanks is my neurosurgeon. And his recent thing is the neurotransmitter surgery where they put like a TENS unit, but really small along your nerve, that they've been doing for like low back pain and disc issues. Except I have peripheral neuropathy on the left side of my head, and he wanted to put it at the top of the base of my skull and cut off that main nerve that sends the pain signals to this left side of my head, which is a minor surgery, believe it or not. And he said there's a big opening there, we have plenty of room to work with. I'm thinking, it's in my head. I'm gonna think about this for a little while, but let's see how that pain does. So, they're really going pretty far in advance into their treatment options with fibromyalgia. But with Dr. Jeffrey Frank, I've been seeing him for 14 years. So he's kind of gone along with me on this path. He's not treating fibromyalgia, but he will treat anything that else that I've got going on, migraines is his specialty, degenerative disc, things like that. Yeah. I believe you need a referral to see Dr. Todd Shanks, by the way. He is with Norton Healthcare, so you will need a PCP referral or a neurologist referral to come see him. Yes,
Do you have trouble standing for long periods of time?
I do. I have, like many of you, I can stand, I am disabled, believe it or not. I know it doesn't look like it at the moment, but I am. I have to sit, I have to lean. There is no standing. I start sweating profusely. I don't know if you guys can see. I hope I don't have stuff going on my shirt here. But I start sweating profusely. I get dizzy and nauseous, and my legs will give out, and down I'll go.
You actually read an article for chronic fatigue syndrome and talking about orthostatic intolerance. It talks
Right,
about it's
that's what it is.
easier to move than to stand. So it's easier to go through the grocery
That's
store
right.
than to stand
Hanging out of that cart the whole time.
at the grocery store.
Exactly.
And I always thought that when I read it, I said, wow,
Yeah,
that's my
that's what we
weird
do.
symptom. explained right
The
there.
craziest thing I ever did was I was walking, I had just gone to the grocery store, and I know not to go by myself, right? We do not go to the grocery store by ourselves, especially if we're in a flare. And it's very short trips. I went thinking it was okay, I can just get in there, I can grab his lunches or something. I got into the frozen food aisle, and I down with the legs, and I thought, I'm gonna be sick right here in the frozen food aisle. So I sat down, opened the door, I was like, oh, it feels so good. I'm like sitting in the middle of the floor in the Kroger. And I had the thing, and they're like, are you okay? And I'm like, oh. It was 10 feet away from the pharmacy area. And all I had to do was get to the pharmacy area and sit in their comfortable little chair and, bask in there for a while. I had to have somebody come and get me. They were like, why did you do it? I don't know, but the freezer aisle was the best place I could have. I've been noticing on, they have the displays of like beer. Those cases, those Pepsi cases, they're wonderful to sit and have a break, because a lot of times they're just high enough for you to kick back and go get us pickles, honey. I'll be right here. Waving at everybody as they come down the aisle. Right? And when they asked me what was wrong, I said I have fibromyalgia, and they kind of looked at me funny.
Yeah. You look too good for fibromyalgia.
Of course. Well, are you sure? And I said, well, I also have hypoglycemia. And most likely, my sugar's low, which is why I'm really itching to come over here and have you guys prick me and find out if my sugar was low. And it wasn't. My sugar was actually okay. It was lower than it should have been, but it wasn't so low that I shouldn't have been able to walk. I was just in a flare. I was hungry. I didn't want to go to McDonald's. I really wanted some fresh food. Any other questions about that?
Makes me feel better, because this morning I was doing laundry and I couldn't finish. I couldn't get up the stairs. I couldn't even walk to the stairs, let alone get up them. And the dryer was going, and I sat on the dryer, and it was like the heat helped. And
Get
it was
those
like
muscles.
resting, and then the heat, and it was like, okay, I can get up and get up the stairs. So now I don't feel so weird.
Is that one of the most common things you guys find, is that you have leg issues during your flares? Trouble standing and walking too long, and the pain or the neuropathy,
Like it hard.
tingling, like in your arms when they get weak, those like just standing, just doing dinner, standing at that stove is torture.
In a
I'll be
flare, I
walking
can.
and my leg will just go out from underneath me and I just fall.
Yeah, that's why I have this.
And now I have to start, I have to get a cane. And I look perfectly fine, but I'm disabled as well. And now I have to get a cane because my legs keep going out on me.
So it's, when you guys collapse, it's your legs, not your brain?
Oh, it's a both.
both.
Okay.
I might not
Mine's
need
very
to tell you
collapsed.
what's collapsed and why,
Yeah.
depending on the day, right?
I don't even have to be in what I think of as a flare. A flare for me is I'm in the bed, but I go to I had a dentist appointment just to get my teeth cleaned, no big deal. I didn't feel like driving, so my husband takes me. I'm sitting there and the dentist comes out and she looked at me and I literally I'm sitting there and I'm thinking, I can't do it. I know I can't do it. I'm not going to be able to sit down. I'm not going to be able to lay down. I'm going to throw up if I don't get out of here. The sweat was literally dripping off my face. She came out, she said, are you all right? I said, no, I'm really not. And I don't know how many times this has happened. You know how embarrassing it really is? I mean, you've got an appointment at the dentist, the hygienist, whoever,
Here's,
I mean, I offered to pay for it. I said, but I can't do it. I mean, Charlie has to help me down the steps. I mean, it's like, and then I get home and I rest a little while and I'm feeling much better. But it happens, it doesn't, I mean, it could be anywhere. It could be here 5 minutes from now. It could be anywhere. Dentist office, there's no rhyme or reason. I know when I'm in a flare, I just don't even bother to go, but,
And thank God for Charlie.
and thank God for Charlie,
Thank
yes.
God for BJ.
That's right.
He's here to help the supporters who are in their position that have to come and get us at Kroger and at the dentist or
I've
carry us back
gotten
to our
lost in
car.
Walmart and cannot find
Have to
my
look
way
for
out.
us in Walmart.
I can't find my way out.
Where
I
you
mean,
at?
really, cry, you know, how do I get out of here? You know, I've called my daughter before, my husband, and it's not like it's the first time I've ever been in that Walmart, but when it comes so quickly, and I get disoriented, I get confused, and then I get upset because I know I can't find the door.
And you've probably been to
And I've walked
your
around.
doctor asking about your hormones. And
I-
why do I feel like I'm flushed and ready to be sick and I'm sweating profusely just because I walked or sat, right? And a lot of us have gone through that thinking we're, you know, the doctor says, well, you're probably just, you know, check your estrogen levels, you're probably just.
Well, they can give you all the estrogen they want. It does not help. Not for that kind of thing. I mean, not for me anyway. I've been to a neurologist. I've had brain waves. They put me on seizures. Said, "Oh, well, you're having seizures. Yeah, I think you're having seizures. You're just losing time." You know, I've never had a seizure that I know of, but I could see the brain spikes on the EEG.
Mm-hmm.
So I'm on seizure medicine for so many years, and I'm having some terrible side effects, tearing my house up and crazy things. So I go to a different neurologist. I said, there's something wrong. It's the medicine. It's got to be the medicine. I've been saying this for 3 or 4 years. There's something wrong. You know, I'm not always. I mean, So they put me in the hospital now for 3 or 4 days and do a seizure clinic to see. There's no seizures. There's no nothing. So I've been taking this seizure at this time. There's no spikes in the brain waves. There's no nothing. So did I ever have seizures? We don't know. Yeah, I mean, was it necessary to be on seizure medicine for 3 or 4 years, however long it was, 4 or 5 years? We don't know, but all we know is now that I don't have to buy that expensive stuff. And I feel no more rage and uncontrollable, you know, that it was the medicine that they say I didn't need to begin with. But anyway, maybe there was something going on, but it's gone, thank you, Lord. You know, but I don't know. You never know. You never know. I still see a neurologist, but not for seizures. So that's one good thing. You know.
Amen to that. I got a question, Bree.
Yeah.
You mentioned your degenerative disc disease a couple times. What's the difference between that and, like, I've been told I have lessening of the disc space and osteoarthritis?
That's a big difference. Yes, osteoarthritis is of the bones itself. The discs are the cushy part between your vertebrae. Well, disc, on an average, they do a little, you know, they do their job like a cushion. They're going to bulge a little bit depending on how you're doing, and when they herniate or they bulge too much and they push up against the spine is when you're feeling, you know, a lot of pain, or if there's inflammation around that area, it pushes up against your spinal cord. That's when you're going to feel that really good pain that goes down your leg. And with people like us, or that have had too much trauma, whatever the case may be, the disc actually starts to degenerate, and it almost like dissolving at a very, very slow rate. And as it does that, sometimes it could rupture, bulge, herniate, completely collapse. And that's usually, that's the part where they usually do spinal fusion or put in a fake disc, something of that nature. Now, osteoarthritis is where you're losing bone mass itself. So arthritis and degenerative disc disease seem to go together. You can get arthritis along the edges outside of the vertebra, but osteoarthritis is completely different. Now, if you have both, well, obviously, you know, you have to take really good care of your spine because you have fragile bones and you have fragile discs.
Because I mean, they keep saying that I have decreased, that my discs are getting, like, shrinking, getting
Right.
squished, but they don't have any explanation. They don't ever explain why.
I've never been
And
given it.
so-
I've had it for 25 years.
That makes me wonder if
A lot of us have
maybe it's that.
degenerative disc. disease?
I have all three, and that's why I don't wanna go back to Christopher Nelson, because he just read my MRI, and I also have, scoliosis, and he just read my MRI and wrote it all, pretty much. And so that's why I wanted to go see a neurosurgeon, because it's been 10 years since I've seen one. And so I felt like they would be able to do a lot more than seeing him, because they've just been doing the spinal blocks. And he's like, oh, well, we could do more spinal blocks. Well, I mean, I'm getting 2 weeks of relief from the spinal blocks, and then it's going back to hurting again. So.
That's
Well,
a
he's not
personal
he's
decision.
not a surgeon, is he?
Right, and I mean.
I mean, he does,
at this
he's gonna
point-
do what he
right.
does, and
And
then,
at this point, I need to see a neurosurgeon from the MRI, because they've just done this MRI. And.
did
so-
Nelson order the MRI?
Yeah, but he pretty much just looked at it and didn't even mention all the other stuff. He just mentioned the bulging disc.
What he can take care of?
Yeah.
What are you supposed to do about that?
Exactly.
What are you supposed to do about the rest of it?
Yeah, exactly.
I'm sorry, I get carried away.
Do you, yes, sir. We have, on our websites and available on our files, and we usually have up here, we have an overlapping symptom page. That's quite extensive, and it shows all these overlapping symptoms that are really common with fibromyalgia. In fact, I think this might be it. There we go. Fibromyalgia and overlapping symptoms A through Z. This page is really just the list. It is quite extensive, and there are things on here I've never heard before that I would have never thought goes hand in hand in an average for a regular person with fibromyalgia. Blew me away the first time I seen it. I thought, this is just crazy, but it is actually, oh man, it rings true. A lot of it is nervous system issues, but then one of the most common things they showed us a lot is degenerative disc disease. Anything along the spine, actually. Carpal tunnel syndrome, a lot of migraines, tender swollen lymph nodes, cognitive dysfunction, RSDS, Russian dysmenorrhea, endocrine disorders, endometriosis. Endometriosis, that's not something you'd think that would go along with fibromyalgia, but it is very common. In fact, I do have that as well. Now, don't laugh at me because I can't pronounce a lot of these things. Endosopathies,
We've got two nurses here now,
Yeah, we
we need some help.
Right in the back here, I do have the whole list, actually. I'm gonna bring this to you guys.
There you go.
Here's the list, and here are all of the descriptions in the back. Would you guys like a copy as well?
She's a nurse also.
Really?
There you go.
Isn't that great?
Give you guys a copy.
I already have all the freeze, so I don't need this. I mean, come on.
I don't need to look at that.
Oh, you don't know.
It's okay.
I think she's one.
There you go.
Yeah, but the rest of us need to help, we need to have your help.
Pardon?
Go down the list and check off, okay, got that, got that, got that.
Here's just a list for those. Here, I'm gonna put the reference, I'm gonna put just the list on the table so you guys can, do you want it the full list or just? So everybody knows what we're looking at here. This is an extensive list, as you can see. There are things on here like vestibulosis, vulvodynia. Vulvodynia, thank you.
I have that.
That is really common.
What is
Do you
that?
really think that that's something we would normally be talking about?
What is it?
It's
Or do I need to know?
extremely painful.
Extremely painful
Okay.
vulva pain.
Oh,
Yeah,
thank you,
vulvodynia.
God. Not yet.
Thank you.
You never know, you never know.
I was a CNA too in in-home nursing, and okay, I'm not going to go any further. Sjogren's syndrome, sleep disorders, RLS, Raynaud phenomenon, otherwise known as Raynaud syndrome, but the phenomena is also, without being diagnosed, very common. Pulmonary symptoms, we just discussed that, PMS, Postpolio syndrome, PLMS, periodical limb movement. Everybody knows what that is, FM, right? And RLS, osteoarthritis. We just talked about that. Non-dermatomal paresthesia. Paresthesia, thank you. Myofascial pain syndrome. Multiple chemical sensitivity. Mitral valve prolapse.
Is it restless legs or is
Who'd
it
have thought,
restless
right?
leg?
Why not? Oh,
Well, it's limited, so it's not.
migraines, the perio,
I have,
somebody else can make that.
I think you need to put all these symptoms,
Neuralgia.
put all these symptoms together, make a musical out of them.
I'm like,
A free shirt for somebody who can say every single thing on this list.
Oh, this one,
Every single thing on this list. If you can say it properly the very first time without messing up, I will give you a free t-shirt. Lyme disease, autoimmune diseases,
restless legs.
lumbar facet erythropathy, IBS, interstitial cystitis,
Dopamine.
extremely common. Infections.
Dopamine.
Now explain to me why we get while we get infections just from going to the doctor and come back and we're sick. Why should we have low immune systems? They're trying to find that out. There's a lot of research being done on that. But why? Right? Why are the endocrines, obviously every single thing in our body is attached to nerves. Which, if it's been, for instance, IBS, that's not that's no brainer right there. You have so many nerve endings in your intestinal tract. It is no wonder it's out of control. If you have fibromyalgia, you have a central nervous system disorder. It's sending additional pain 4 times the amount as the normal person per square inch of your skin per body. 4 times per square inch. That's 4 times. That's a lot, right? Now apply that everywhere and think of how big your intestines really are. No brainer, right there. And of course they're gonna freak out. Of course they're gonna you're gonna go into spastic colon and all the stomach issues that you're gonna go through with the nausea because your central nervous system has gone run amok throughout everything, and that's one of them. Now, vulvodynia, I said it right, has a lot of blood vessels and a lot of nerve endings there, so that makes sense, right? Including your uterus and other things in your body. So, a lot of these actually make sense.
Hands, too.
Yes.
I got a question. I don't know if anyone is familiar with HSP. It's a highly sensitive person. It's a doctor that developed this. I think it's still more of a theory, but
Like
according-
allodynia.
I don't know, but it's not just like skin or tactile sensation. It's everything.
All your senses.
Yeah, senses and psychologically more sensitive. And is that what you're calling it, allodynia?
Yes, it's actually heightened of all your senses. So
Uh-huh.
it's painful in all of your senses.
Okay.
Sensory integration disorder. And we can come up with probably 5 different names for that if you really think about it.
I think there was an article though in one of the reference articles that was on the website was talking about, I think what she was talking about where everything, things like above and beyond.
I subscribe to the newsletter for this doctor, so I can post it on the
That'd be wonderful.
on one of the Facebook pages or something.
Absolutely.
It's very interesting, because when I found that, I was like, I never thought of myself as being all that sensitive. But when I started reading through the list and actually taking the inventory, I thought, oh, well, this explains things. So, I'm all about trying to figure out the cause and effect. Is that what has caused the fibro? Did the fibro cause this? It's back and forth. So
I'm
just find it
guessing
fascinating.
you're probably an A-type personality as well.
I wouldn't say that, but probably.
Do you have things in very organized manner at home?
You're in denial.
We're all in denial. We're A-type personalities. Sure, you're not. Sure. There's a theory about why so many of us here and so many people diagnosed with FM are A-type personalities.
Yeah.
And one of the theories is because it is a personality like that that doesn't give up, that needs answers, that needs
Right.
details,
Yeah.
that will go above and beyond to find out what's wrong with them. They're the ones that get that diagnosis. They're the ones that want to talk about it. They're the ones that want to take control, because that's what they do, and they're losing control, and it's freaking us out. And we're like, oh, no, you did not. I'm in control here. Me. No, you did not just do that to me. Oh, yeah. It's a mind game upstairs for people like us. It's like, you gotta do things like run a support group just to get it off your system. Right? And take us away out of our job that we've worked so hard and earned so many degrees for, and yank us out of that because we can't drive to work, we can't make it through work. We're leaving, coming home, we're calling out. Why? This is not me. I don't miss work. I work hard. I work harder than anybody. I know my job. I'm probably the person who's in charge. I'm probably the person who's the programmer, who's the manager, most likely. You're the person that has moved up substantially or is most commonly in charge type person. And you take that away from them. You pull that rug from underneath their feet, and it's disaster in our brains. It's like, you cannot take this from me. This is what I do. What am I gonna do? I can only clean my house top to bottom so many times, and I can't even do that.
Can't even do that.
I can only organize my spoons, my forks, and knives so many times before I go nuts, right? Oh, man. Spoons are gone. Right, so, yeah, and that should be on here, right? It should really be on here. Underneath the depression and the anxiety is, oh, no, you didn't. That complex that says, I know you just did not do this to me, and I'm going to make sure I find out why, and I'm going to take care of this right now. And that is one of the theories behind why there's so many A-type personalities that come out, and we'll talk more about that. And it is our job, because if there's not an actual correlation, then it is our job to make sure we reach the people who aren't in that situation or in that mindset, to bring them out of the closet and bring them out to the open and says, I'm here for you. Yes?
I think we gotta get that to some of the doctors, because one of them told me, not one around here, thank God, but one of them told me that we had more in common with each other than we did with the disease.
Yeah, absolutely.
But it wasn't a very nice term, because he doesn't believe in it.
Like the group psychosis.
No,
How can they deny
He was at,
the latest research that comes out and says there's a central nervous system disorder? Because they're probably not updated on their research.
they're not updated.
Right.
And the reality of it is, I had an instance where someone very close to me had sat down at the dinner table and was doing this all the time, and I looked on the web, that horrible web where you find things out that maybe doctors don't know, and he had been to 4 doctors, and he had Huntington's disease. And the 4th doctor is the one that finally pinned it, after I knew about it for a week and a half, just picking it up on the web, They don't read as much as we think they do. At least some of them do not.
Is it true that nurses really know more than doctors?
And pharmacists.
Which leads me to ask, and not change the subject, but has Dr. Barrett had his meeting, his
I don't know.
We're not invited, huh?
I don't imagine this is a public hearing,
don't?
but don't quote me. I haven't heard anything about this.
I wish there was some way to know about it.
We can probably contact the Board of Health.
Beginning of the year.
It's not gonna be until the beginning of the year?
Yeah.
Oh, crap.
You can still go see them.
We have somebody that knows.
Oh,
about
yeah,
it.
you can see him.
Back to the research,
I'm not
you
gonna
mentioned
know.
the doctor.
If he's writing scripts for meds,
The research,
just get him in one
Dr.
shift.
Dr. Howard and Dr.
And then we're from John Hopkins or?
Huh?
We pull that up.
Okay.
Nurse practitioner, a male?
Yeah,
And this is on the Facebook, I can get these things.
and I was going back to next month to see
You
him.
sure
about
can.
insurance.
It's called
Overall.
fibromyalgia, an afferent
So they
processing
sell you
disorder
$130
leading to a
and I
complex
can't see it.
generalized pain syndrome. I'm gonna pull it, it's coming up here.
What a riveting
Oh, yes.
I was gonna see
That's
him.
someone list.
Now, for those of you who've never read a focus review or a research article, please don't feel intimidated by all of the information that's in there. It's actually
Effort.
easier than you think, right?
Fair.
Howard Smith, Richard Harris, Daniel Sloss. From Albany Medical College, Department of Anesthesiology, University of Michigan, Ann Arbor, Michigan, and then other doctors who they worked with. And then this was published, I believe, painphysicianjournal.com.
Okay.
Where we receive all of our research articles. Yep. This can be found on all of our websites. When I say that, I mean Facebook, Meetup, and our journal page, website
Okay,
page.
meet up.
Mhm. It's there. Everything that we talk about is also on, you can find in our files menu. And if you don't have the internet, I'll mail you a copy.
That's okay.
Okay.
I'm the type A of this.
There you go. The most part, the rest of that, aside from ankylosing spondylitis,
Ankylosing spondylitis.
spondylitis, we've pretty much gone through a majority of that. That is stiffening of your joints, while spondylosis means vertebra. So,
I just wanted to say to you real quick, you
Yes.
said that you're the type A personality in this relationship. It's a good thing for somebody with fibro to have a type A person with them. It's a huge help. My husband is definitely type A, and surprise, surprise, I didn't get diagnosed until he came into the picture and took me to the right doctors. And it was also in Australia instead of here, but I think it was partly him, and he's the one that, keeps pushing me to get to the bottom of things when there's something wrong.
It was interesting, my sister diagnosed my husband a year before his doctor did.
Yeah. See, because that's what
So, she mentioned it to me, yeah.
I diagnosed myself before I was diagnosed, and I knew, but all the doctors kept saying that they didn't know what it was and all that stuff, and because I'm not type A, I wouldn't pursue it. I'd just be like, okay, I'd just shrink away and go hide in my little hole, but having a type A spouse, it keeps me from doing that. He won't let me do that. He'll let me do it for a day, but then he won't let me continue to do it, and so that's very
Donnie
valuable thing.
drags his feet with going to the doctor. He says, I have the doctor's appointment in July, and it's May, and I'm like, you need to see a doctor now, that kind of thing. So, but this is very interesting.
Before we go any further, I really want to plug in really quick. We do have an Afghan that was made by one of our members, and it is going on for, I guess, auction, donations, kind of auction. We'll have BJ, go ahead and model it down the runway, BJ.
Started out as a pot holder.
It started out
As a pillow.
Then it was, she literally finished this up during our awareness picnic. She sat there and finished it up, and God love her. So we're going to open up a GoFundMe page and start receiving donations. And of course, the highest bidder will receive an Afghan, and these donations go towards helping us. And she put a lot of work and a lot of money into that, and we deserve to help out, spread the word out there that this is a really beautiful Afghan. So, sorry, I had to plug that in really quick before I forgot. But at any time, please interrupt me. I talk a lot.
Well, learning on our page, whoever posted a post about I'll do the same thing, the costochondritis. That is, that's the thing that hits me hard as a fibroid. It's always, I sit there and I'm having a heart attack, I'm not having a heart attack. I'm like, do I need an ambulance? Do I need, first few times, and then when we spoke about it in class, I was like, this is what it is.
How many people know the symptoms of costochondroitis? Thank you. Somebody's gonna get one of free teachers, I'm telling you. It's me, obviously. And also myofascial trigger points in your back that will cause almost identical symptoms, as well as thinking you're having a heart attack. Anybody know about that? No, how many people know that correlation? This is a real thing. I don't have this. So this is inflammation in between the vertebra of your rib cage, and extremely painful. Whereas myofascial trigger points are these along the bands of your muscles. You get these muscle knots, I guess you can say, that build up, and if you let them go too long, this is my downfall. This is why I left work. It can spread around your chest, and you know when you get those Charlie horse feelings in the rest of your body. Now imagine this coming around your chest and up your arms and up your neck, and those things burn, and suddenly you can't take a breath in, and you truly, I've been to the ER twice for this, truly believe you're having a heart attack when you cannot take you're taking shallow breaths, you can't move at all. So these are very similar. I don't have that. What I do have is myofascial trigger points. I just found this out 6 months ago.
You can find out what they were. We knew you had the knots. We just didn't know what they were.
Yes, I've been suffering from them for 7 years. And this, knowing I don't have that particular disorder, why do I must, right? Because why else would I be going through the same thing they go through? I'm just not as frequently. It turned out to be those myofascial trigger points. And when I let them get too big and I don't get those things worked out, snap those things apart, they come around, and now I know what I have to do to get rid of them.
I knew I had the knots in the back, and I knew I get the shortness of breath. I just never associated those two together.
Yeah. If I let them
I mean,
get
it
on
makes
hand
sense, though,
burning,
yeah.
eventually you lose control of your arms.
Yeah.
And it's like it comes out of nowhere. It builds up and you're like, oh.
And what do
here
you
it
do
comes.
to?
I go to hands-on physical therapy, and their massage therapists, I go there strictly for myofascial trigger point release.
Okay.
I don't get a nice, wonderful massage. They literally push, and they taught BJ how to do this so that he can do this at home. How to push every one of those out. If I let it go too long and they get too big, I've had one that's that big, that stuck out of my skin this far, and that big. It's awful. They're really hard to work out, but they are possible to work out, and this has to be done on a regular basis if you're somebody who gets something like that. They can be as tiny as really tiny little pea, or a little bitty tiny grain of rice, and they can be up underneath a muscle fiber that's really hard to find. But a really good massage therapist will know how to spot those right away and know how to work those out. I happen to have one of those who can find them all over me. She can push those babies out, and I'm like, oh, so much better. And then she works on the big ones. And so, if you can find somebody that knows how to work on those, really knows how to work. Not just a deep tissue massage therapist. We're not talking about that. We're talking about somebody who knows how to release myofascial trigger points. That will be your saving grace. And since I've had those worked on a regular basis, I haven't had only one of those attacks. So it's amazing. Yeah, but that
But
particular
when you have
disorder.
the attack around your chest, what do you do?
Nothing. I have to literally, you have to get a muscle relaxer in me. My husband has to literally help me drink, because trying to lift my head makes something much more, painful. So I literally have to get supported underneath my elbows. I have to be at a particular angle on my bed, and with my head and neck supported, and literally don't move. So I don't even, sometimes can't even use the mouse. I have a wireless mouse, and I basically have to slip it off. I have to wait for that muscle relaxer to kick in. I have to take a Klonopin because I've been known to hyperventilate through these, thinking I was having, when you can't breathe and you have high anxiety like I do, you hyperventilate. Hyperventilating during one of those is not cool. It's the worst experience ever. And the ER people will look at you like you're freaking nuts. Because you need to calm down, you're just having a panic. No, if you send somebody else back in here to give you a massage, I could go home. You just come in here, give me a little massage back here, work that knot out. I'd actually be out of your hair, get your $150 and I'll go home. Won't even bother you a bit on flat. That's not, no, there's no saying that. And that really is all it is. So yeah, I have to wait and I have to let it calm down on its own. It's a lot of medication, a lot of calming, a lot of shallow breathing, not moving at all until it passes. If I know that I'm on the verge of getting there, it's as much massage as I can get, hot baths, or the heat and the cold heat compresses. Whatever I can do to relax my muscles and try to get those out myself, I'll do. Or I let it get that far, but that burning in between my shoulder blades was my downfall, and I had no idea what it was. And I was just told that, it's upstairs. How could you feel like your shirt's on fire back there? There's nothing wrong. There's nothing going on back here. We've done every MRI and every CT scan of your body and your toes, and there's just nothing. There's nothing. There's absolutely no reason for you to be thinking you have a heart attack, that you can't breathe, you feel like you're on fire, and your arms don't work. You're having anxiety attack. I'm sorry. You need to go home and take some antidepressants. That is the most common response.
I've told the people at work, I'm taking an aspirin just to be sure. I said, but if I'm on the floor, call a 911. But right now, I think I'm having a heart attack. I'm not nauseated, but I'm having every other, and you sit there and you doubt yourself every second. Is it not? Is it not? And the whole time you're going, oh my God.
Have you seen those big boil boards on 65? Is that the most common symptom of a heart attack? I'm okay.
Yeah.
Right? Seriously. The most common downfall, common symptom of a heart attack. Well, we'll never know if we're having a heart attack because we have fibromyalgia.
Yeah, when are we okay?
Why? How do we know? Of course we're seeing you all the time. We just want to know if we're actually supposed to be seeing a cardiologist or not. Just tell us. We'll be out of your hair. No? Good? All right. So, it's an attack. Now, can you guys have a massage therapist? I don't know what else to say. I've just been saying that a lot, and I get that look.
I can't do that. You all talk about that deep tissue massage. I cannot.
No, it's not a deep tissue.
Well, I mean,
massage.
that massage period, I can't stand someone who massage.
It's either that or it's that. And I'd rather do that.
Oh my God, I just can't stand it. I can't stand my feet to be rubbed, that hurts. Oh, so bad. I just have to get past that.
Are those trigger points the same kind of trigger points that the trigger points that hurt?
Where your tender points are at?
No.
Or the trigger points for like pain in your spine, things like that?
Yeah.
No. These are buildable muscle tissue under muscle on the strands of muscle tissue itself. And so, if you put an injection in that, that's
Basically, I feel it, so I know what they feel like. It's basically like a guitar string, and you'll feel it, and in the middle you'll feel the lump, and then it goes soft. So what I do is first you have to realize which way muscles go in your back, which there's a bunch of different ways they go. And hers usually go this way, like this. So what I do is I start from the top and I rub it. You can't go this way. You can't go back and forth. It'd be like plucking a guitar string. It hurts. You have to go a long ways with the muscle. So once you go with the muscle, then you start to loosen the muscle up and it starts to relax a little bit. Then I can work on the lump. And then what I do is I just go to the lump and I kind of rub on it and I kind of press. You just press and you hold on to it. They told me 30 seconds. And if it doesn't release, stop. Go to another spot. I just count my head. Now I start working on the muscle again, then I go
or
back
until
to
I
the
say
thing.
uncle.
Or she'll say uncle. And then eventually I will get to that point to where I'll have the muscle relaxed enough. I'll be on the rise, the muscle, the noid or whatever, bone. And I'll just hold on to it and I can feel it just kind of jerk, it's dissolved. It goes to nothing and then it's completely smooth. So then I just rub it a little bit. By that time she's pretty sore. So then I have to move to the next one. And I'll fall off. Fingers are hurting. But I know it's gonna be her to have that.
And him.
Yeah.
Yeah, it's a lot better for me too. But I
Yeah.
mean, you know, basically, you just have to understand where the muscles are going and how they feel. And if you have them and you have somebody that's rubbing your back, they will feel it. They just have to realize they can't go like a guitar string. You don't want to plug it. You wanna
Plucking it
go
is
this
probably what you
You wanna go
feel
along.
during a deep tissue muscle
Yeah, because they're
massage.
going like
When they're going
this.
in there and they pluck those strands that have those trigger points on them, that's the most painful thing. That's where your whole body does that
She'll
jerky
jerk,
thing.
and I know. And sometimes I do it on accident because in order for me to feel it, for me to feel that muscle that's tense, because you can feel muscle and it's mushy. And then you get that one, it's hard. It's real tight. And once you push across it, in order for me to find it, I gotta push down and go this way so I can feel it rise up and resist. And then sometimes my finger will slip and it'll go down and she'll jerk. But she understands it's what I have to do to find it. But once I find it, then I can work on it and then I can get that knot out. And then it's a lot better. But that's the majority of her fight is probably her shoulder blades here in the past year and stuff.
Yeah, they've been getting worse.
What we fight with.
Yeah, so we actually I happen to have this
Yeah, so we're sitting in the
Anatomy and
bedroom and we
physiology
pull the book out
pocket
and I'm looking at
thing.
these muscles. I'm like, okay.
And
this
it's
one's
just a
on this way,
diagram
this way, so I remember.
of your shoulder
So I
blades, your
know.
deltoids and your
Now I go in there.
trapezius and those muscles. And so we just literally brought this out because I could tell him where it was out on my back, but I didn't know which muscle group it was. So I'm like, my doctor says it's a trapezius muscle. He's like, I have no idea what that is. And so I brought that out and I showed him and he's like, oh, yeah, I know what that muscle is, you know. And so once we realized, you guys probably don't even need to look at that. Once we learned where my muscles and how they went and which ones went up underneath each other, crossed this way, and how we had to get to them, he made it a lot easier. And he did not take massage school, massage therapy school. And he does an excellent job at it. In fact, I took my daughter to the massage therapist, and I had her show my daughter, when my daughter came back from Quantico, you need to show my daughter what this is. And so she brought her up there and she showed her, and Heather's like, wow. You know, my daughter was like, oh, that's really good. You know, she didn't want to touch it. She's like, I don't want to hurt my mom. And she's like, it's okay, you know, push on it.
I'm like, give it here.
And my daughter was really scared to do it. You know, that she just knows that it hurts mom. But when she felt it and she felt it release, she was like, oh, you mean that's what's wrong with you? And I'm like, well, one of the things that's wrong with your mother. When I can't move, you could probably feel what is causing all that. And if you happen to be here, I can really use your help here. And it made a huge difference. So if you've got family and friends who are willing to learn about those, and that is a big part of your issue, show everybody. Here, right there. I can feel it with my finger.
Printed up with the back.
Yeah, yeah. That's a really good idea.
One thing I have found though, doing it without any kind of oil or anything makes it really hard to do. We just use like a hand lotion. Anything that's easy to wipe off.
Because if you slip over
Because
those
you can
bands.
slide on it, you feel a lot more. If you're doing it dry-handed, you really can't feel much because you're constantly fighting skin. So you really can't feel it. But once I put lotion on her back, I mean it's like instant. You can feel every muscle on her back tense. You feel every knot, and it relieves a lot of stress, and she just instantly feels better. So, and then of course she goes and overdoes it, and then the next day I got it again. Sometimes I just let her suffer
Never.
for a week.
I have no idea what he's talking about.
Is there any questions? Anybody that has questions that they want to ask or curious about something? Or?
About that elemental folate, if you look at like a vitamin shop or Whole Foods,
You can.
I looked it up, it's like $8.99 for a bottle.
Not in the same dose. But actually, because I ran out, I've actually been taking it some over the counter stuff. It seems to be working okay. So, yeah. You can try it and see how it works.
Post that information on our website, on our sites, if you can, especially what you said you just found. You can post that for us, that'd be great. I'm sure everybody likes to try something new, especially if it's food stuff.
That article they posted about people with fibromyalgia had that tissue in their hand.
Oh, the extra blood vessel thing,
Yeah.
and they did the
Yeah. So I'm sitting there looking at
biopsy?
my hand.
How do you do all those things?
Yeah, weird, huh? You know, I'm not gonna let them take a biopsy of my hand, because I know what's going on, but, yeah, they're finding all kinds of things. Have you guys heard where they took the biopsy, people with fibromyalgia and found that they had extra blood vessels? So coming to the skin on their hand? You guys hear about that? Yeah, they're doing all kinds of, there are so much
I know, we found out very much.
research going on worldwide. The amount of research studies out there right now are enormous, enormous. The ones that actually make it through enough trials to get to somewhere where it's substantial nature that they publish it and say, this is, you know, we've had enough research on this and that, you know, we can all come to a consensus that this is true. But when you have 28 people in one research study and they find these findings, and then they post it all over all those, you know, really cool health websites, you have to take that in face value, what you're reading here. Remember that unless you find it on the Pain Journal, that, you know, the page that I showed you where we're getting our research, unless it's there, it's not something that's thoroughly accepted as mainstream research. I guess it's just starting. And, you know, it's interesting. I'm sure everybody finds out about it really quick. You probably ask your doctor, who's probably like, yeah, I probably heard about that, you know, on TV or something. They're talking about it on CNN, whatever the case may be. But, you know, until he gets a pharmaceutical rep that says, give your patient this or that, yeah, not really too much of a difference when you tell your doctor about it. But it is interesting because that means it's something that you need to watch for. Like the FM test, when that came out, people thought there was a blood test to find out if you had fibromyalgia because they named it the FM test. It is not a test to find out if you have fibromyalgia. It's very deceptive. It's a blood test to find certain markers in your blood that could, what were they? Ribo something? Let's pull it up. To find these certain markers in your blood that could indicate a possibility that you could have fibromyalgia and that, you could, you know, hey, go have this checked out because you happen to have this in your blood. Now, and then it's not covered by insurance this time. Oh, that says case. Oh, there we go. Okay, the fmtest.com. It says simple and definitive. Yeah, you know, sure. It is a definitive blood test that does not tell you you have FM. It's actually, let me find it here.
It says act now, anything that says act now.
Yeah.
Order FMA now. Yeah. For $744, it could be possible to know if you have fibromyalgia in a fraction of the time and money patients currently spend seeking a diagnosis. Wonderful. It's a multi-biomarker based test, which concerns immune system, white blood, chemokines? Chemokines, did I say that? And cytokines? Patterns. Now, remember, this is patients with fibromyalgia have a significant dysregulated pattern regarding these proteins. There could be other reasons why you have this. It's not a definitive test. It is something to take to your doctor that says, hey, I spent $744 and you please find out if I have fibromyalgia because it says I do.
Because you're.
Right? So, when your doctor says you spent $744 on that, you're damn skippy. You better tell me if I have FM, because it says I do.
I think that's why doctors have so much trouble with this though.
Yeah.
There's
That's when they're
there's
like-
no
Can you
definitive
make an
test.
appointment for this
That's
woman
right.
every week, because she's willing to pay a lot of money for these things, sure.
But 80% of us can't stand.
Yeah, if you want to spend the money and find out if you have FM or if you have, let's say, CFS or, you know, sarcoidosis or something else that's mimicking, even lymph disease, Lyme disease. And, or if you have, had, what's the kissing? Mono. If it's just mono, if you really need to know if it's just mono or if it's FM and you're willing to spend the money, that's wonderful. I encourage it. I think it's great. But just remember, it doesn't tell you if you have FM. Okay, so, you know,
Tells you that you
when these
don't
research
have
things
something
come out.
else.
Yeah. So just keep that in mind. And when you read these research, when all these things come through and they get posted on our site, when I let everybody post these on the site because it's great information out there. It gives us something to work with. That means there's still hope. They will find a cure for this. I'm gonna say they're gonna find a cure because I have hope. Because I have hope, right? So yeah, read it, bring it in, give me all this information, put it on our site. It's wonderful information, and I think we should be sharing it, absolutely. But please don't spend $744 if you're absolutely sure you already have fibromyalgia, unless you really, really, really think you need to know. Because, I mean, it's
Well, would that help you on a?
if you have additional
disability
cytokines in your blood system.
case?
You can find out another way without paying $744 if you have additional cytokines. Please do.
At this point though, what is the point of finding out if you definitively have it, because there is no absolute definitive treatment.
True.
So, you know, treat it symptomatically, like, you know.
Well, you know what, the whole point for somebody who specializes in FM is they take a lot of things, they group it all together, and they're supposed to rule out everything else before they say you have FM. As per the American College of Rheumatology guidelines, each physician should be eliminating all the other things that could mimic FM before they tell you you have fibromyalgia.
You wouldn't know till you were 95.
But it doesn't take that many blood tests to find this out. It really doesn't. Autoimmune markers, there's just, you know, a lot of vitamin deficiencies, hypothyroidism. There are a lot of things that could be contributing to what you're doing. Hypoglycemia, diabetes. There are a lot of things that simple blood tests can find out. They need to rule those out, and you need to treat those first. And then if you still have these symptoms, and you keep looking, you go to your endocrinologist, you rule these things out, you take care of all these other issues you've got going on. If you still have these neuropathy type pains, if you still have fatigue, if you still got migraines, if you're still foggy, after they've ruled all these other things out, that's when they say, you know what, you might very well have fibromyalgia. We don't have treatment for it. Hurt. Absolutely, but we'll have somewhere to start. And you say, I've got $744 to tell you you're right there. I know. I just ruled out something else for you. And then they'll say, yeah, okay, so you know what? You just very well may have FM. You're right. We don't have particular treatment, but you know, this is where we can start based on your symptoms. Based on when you filled this out today, you told me this is everything that's really going on with you. The most prominent thing right now are your migraines and nausea. Let's address those first. They have to address all your individual symptoms to get to the core of your fibromyalgia pain. They have to get you unstressed. They have to get you healthy. They probably have to take you off a lot of your medications to find out if those are contributing to those migraines and that nausea. There are a lot of things they have got to rule out to say, like myself, I have peripheral fibromyalgia. And with or without my medication, it's there, plain and simple. But I also have degenerative disc disease. I also have peripheral neuropathy. I also have, you know, chronic migraines regardless. I also have depression. Whether it's all caused from the same place or not is irrelevant. I do have FM pain, And I'm pretty sure, and all of my doctors are, in fact, Social Security Department decided, yes, you definitely have fibromyalgia, and you have this, and this. And it's pretty safe to say, you know, you should be treated for this. So, but obviously it took me 10 years to get to that point. It's gonna take somebody who's just been diagnosed with FM a while to find out if that diagnosis is true. Because the very first thing I say, if you come to me today and you said, I was just diagnosed, so well, what blood test have you had? Well, I haven't had any blood tests. I'm instantly going to say, I'm glad you're here. Not because I agree you have fibromyalgia, because I want to teach you how to find out if you don't. I don't want you to be here if you don't have to be. And it's not coming out, it's not meaning to be crude. You do not want to have fibromyalgia. It can be a throwaway diagnosis. We know this. We don't want you to have this. We would much rather find out that you have mono than fibromyalgia, okay? So
That's a different treatment path.
it's a completely different treatment path, which means you don't have a central nervous system disorder. That is huge. That means it probably won't affect, you know, and turn into IBS and neuropathies and all these other things that mono may not contribute to. So, you know, or we may find out you have Lyme disease. Have you found out if you have Lyme disease? Oh, yeah, I was bit by a tick, you know, 10 years ago. But no, nobody ever checked. Why? It's a simple blood test. If your insurance covers it, that's the first thing I want to know. Next time you see your doctor, say, the woman that runs this support group was so adamant. That woman went on for 20 minutes and didn't shut up about how these blood tests I'm supposed to have done. And then she'll probably be like, did you go to that fibromyalgia group in the library? Yeah, give me your paper. Okay, so we're going to set you up for the labs at LabCorp, and we want to have this. They know, we're going to tell you. They do. So,
Walk our dog.
thank you for coming.
Thank you, all right.
Thank you.
Sitting here listening, my back.
So we do have some flyers out for the SOAR Fest. We will be there and supporting them in New Albany on September 2nd. The SOAR test, Survivors of Abuse Restored. And a lot of people are triggered fibromyalgia based on trauma. If this is one of them, this is a great festival to come to.
That's one of the 3 things, but Dr. Goldstein's doctor I saw in California, that was one of the 3 childhood abuse.
Childhood abuse, yes. Could be a trigger for fibromyalgia if you have that. Yes, so this is great. And, you know, I remember Jen here, a member of SOAR and helping run that. We're going to, you know, get the word out, and, you know, it's here in New Albany on September 2nd, 7? Yes, from 12 to 6. All kinds of really cool things. To sit out in your wheelchair with us and let your kids go out on the bouncy thing. Yeah, why not? And talk about things. It's great. Yeah. Don't say, Jen, she's not. Babe. She might, yeah, you know what? She spent $744 on us.
Bless her
But God
heart.
bless her heart. We don't hold that against her.
Bless her heart.
I don't really slam the FM test that bad. I just think it's kind of funny that, you know, the way that they advertise it is off. So thank you very much for coming, though. We can keep it going, but feel free to go at any time.
I had a question. My husband and I are actually applying for life insurance. And, you know, they do blood tests and all the other stuff. And when he found out about the fibromyalgia diagnosis, he goes, well, that's going to cause a, you know, red flag to pop up. Has anybody else had any experience with that, trying to get life insurance?
For your life insurance?
Yeah. I guess,
That's another first.
I mean,
there's
that's
no
the first
reason
thing
for
that came out of his mouth.
You don't smoke? You're not gonna get
Suicide rates, maybe? I don't know, because that's so high.
Suicide rate is very high for those in chronic pain. And fibromyalgia is a cause of chronic pain. Yes, suicide rate. If that's what he's referring to, then he has a valid reason.
He never really said
It's
what.
an underwriting thing.
Is it?
Yeah. The insurance rep. Yeah.
Now, I got life insurance about 4 or 5 years ago. And
It took them 2 hours to get through all my problems, but nobody said the fibromyalgia was gonna be the problem.
So they
You
can't
might
deny
wanna
it.
contact her agent.
Maybe so. No, they can't deny it because of that. That's, I mean, I'm just hoping.
I'm gonna take this on with me. Yeah, this comes in handy with my page,
And
remember?
it's nice bright green.
Nice bright green, go right on my fridge, so every day I can be like, I won't forget. I won't forget about this. Thank you guys again, and it's really good meeting you guys. Yes.
Oh my God, it went up beside me, one minute, I was like, what the heck? It's the picture of it. And like, I was driving along, I just stopped and took a picture of that car. Then I saw where it said, Bubbles
Hour
House.
in the
Is this half or less?
Oh,
yeah, I have some.
And it's
We're going through the process and doing the.
And yeah, I'm singing and I'm super nervous about stuff like this. Awesome.
Just imagine everybody in the audience, you just remember, we're managing everybody is naked and then you're okay.
I don't think I want to see a lot of people in the audience.
Well, you just close your eyes.
Sure, I knew I had to bring more down here, so.
They do, they come in around when you really handy, don't they?
It's another one.
Lindsay? Thank you guys very much.
To meet you. This is truly uplifting, just to hear other people talk. The whole thing of that,
You know, we just.
sit here going, no, she's,
I mean, you read it before, but re-up it, I guess it was a thing.
I took my notes on things I'm gonna go right down. The problem is, no one's gonna believe you, it's a woman's disease.
Yeah, that's why I don't tell people it's crazy.
You should.
Oh,
You should. You should tell them, you know what, I have a genetic disease that's under central nervous system. Causes a lot of pain, and, you know, I really pray that nobody else gets that.
So I don't think we're having kittens, or that we're, have some kind of psychosis.
It needs to be talked about.
How his last surgery was. It was
I used to live in that, but I don't recognize.
in order for my.
Oh my God.
They're really hard
Oh, it's okay. I live in the
much bigger than their weight limit is. So I said, I will put a vest on her so that people around the complex don't start thinking, oh, she's So, you know, she wears her little thing that says service dog in training. As long as it says in training, I'm still legal. I don't try and take her anymore.
But I am very, very.
By Monday, no one like
No, I
that.
wasn't.
She's gonna help me.
Near and dear.
Like, what's wrong with you? You know, when people, I can't believe people ask that.
I can't either.
Right, that's crazy. And I'm like, well, I've got this, so.
That is
So
my
what they
trigger.
basically do is they
It's gonna get worse over time.
But you don't look sad.
I just know from being a nurse, there's they don't really at first when people were being diagnosed with fibromyalgia. I'm really sorry, but so many were drugs.
I'm a little bit more.
And they may have been drug seeking because they were so bad. And nonetheless,
It is a really bad thing. The whole pain management, like opioids, prescription abuse. You put you on the radar right now. I'm gonna tell you, it's top priority for us. Top priority for us, the NFL. Jan Chambers, president, has been to the FDA. She's on board.
It's kind of funny when you see somebody lift like 1 foot in the morning,
It's very hard. The input that you give her, and all of our side, I mean, you guys are actually have unprecedented pain, so I mean, I just started getting to the point where I was going to talk about it.
There's only 2 states that
I mean,
are
I
going to
just,
take.
I was, that it was getting so stressful that I just went, I honestly just
I
went.
guess Wisconsin, most of the states are going to sign on, with the exception of Idaho and Montana.
You know, they're still trying to get it to the store, but, I mean, and I
now we're at a medical office and they.
Is, and CPS is training doctors.
But thank you for that.
Yeah.
They're training with the doctors. The doctors
Just
are
challenge
for
at
XYZ.
People in my group,
Walgreens got me.
I'm not keeping up with,
Walgreens is doing
me,
lots
and it's
of
like, I
stuff.
get it all together, I got, we would look in there like, here's just some of it people up. You can get up on your side. I know, I
I can't give the medicines because the anxiety.
And you're just eating them,
Triggered anxiety.
now, if you want to eat bread, you make your own
I
bread.
can't have anything with serotonin.
Is it to that level or what?
This does not have the serotonin in it.
So I don't know if it's or not. Where you go down without there doing it responsibly though.
I know.
Oh, no, I'm.
So they
For your pain medicine.
I'm not trying to criticize, I'm just saying, I have seen, my doctor that I go to, he's wonderful. If I ask him before he said something about it being able to regulate the blood pressure, not for very long, but he's probably like,
I don't like things, I don't worry about
I don't
things.
want to.
So I just drink
That's
water.
such a pain in the butt, so I started. I don't want, so
I want to do
Yeah.
Oh, I like
It's buckled down in the heart, but in the part today,
So,
So if you have nothing to
it
do,
actually does have a lot more.
do you get grilled fish, salad,
So then
When I
Yeah.
have Thursday, that's what I go with the morning.
They're not
That's what I
just
do.
right?
But I want to.
But you know what, and I don't think that's in the report, I'll get, you know, like, they think more about it about.
One thing into another.
At my house, I didn't know that they thought I was selling drugs and I had doctor. And I mean,
I can do it for like
I think
but for legal reasons, I really don't have to swear about it.
but I can't, I mean, it's highly
And, you know, establishing a trust with a doctor, you know. Yeah, I have to meet my doctor.
You prescribe something.
Now we just have to meet my deductible.
I don't want to lose my vaccines here. I don't want to lose my vaccines, so we're being good doctors.
It's okay.
It depends on your level of pain
What is it?
I mean, mine just
came out, it's not as easy.
yeah, they're working the state, so.
Well, the problem is turkey, and then, you're going to obviously adjust.
It used to be, you know, it's
And your doses are going to increase. Or I
What I need to know where it's written.
I mean, I was told like.
It's actually.
And there's no reason that you can't.
There are
It's just that.
I know.
It's not horrible.
And they keep up to me,
But for physical therapy,
and I have like free prescriptions, they get 3 months worth of their painkillers.
That's very good. They did that too.
Well, because they know I'm having a there. Well, it's for.
You actually will have.
That's what the best
Advocate better chance of getting medications or things like
So that's what I.
actually low back pain.
Yeah, so, and my osteopathic.
It doesn't even have to show up on an X-ray or MRI. Just chronic low back pain, figure some
What are you gonna do this weekend?
And our low back pain is real. Now I'm getting my meds for peripheral neuropathy. So I'm getting the touch rod. I'm actually getting those things as needed.
I've been really good.
It's a standing prescription and they have cover classes in the water.
And,
And they offer like,
That is.
peripheral neuropathy, you permanent.
Give it to her if it helps.
That'd be the first thing he tells you, don't
Nobody's
care.
saying anything.
Tell my son that all the
Doesn't
time.
realize,
Don't be that way.
They're like, oh, I know.
Get already stuck.
You know, just you have to go through that. Thanks.
Was it actually over the hospital complex? No, it's behind the house. Like around also? Yeah, it's the
The debate on this is really good.
I took CBS for, I took.
Well, it's got
I mean, and also I love it, it just, it's super wide, it's also
We
kids,
are the generation.
and the water's cold, this is warm water.
Yes, see, that my mother does have a thing there in the pool. Usually empty with I go there, so.
Oh my God. We don't get out. We took her and
You know what? And then you stop.
Yeah.
And then you do, I've had that every day.
Once I do that, once we get to 30 minutes.
Have you gotten it
I've
already?
been to the point that I've been able to switch over to some of the land, like the treadmill, I've been able to keep it over
That's horrifying to me right there.
even with my back.
Diagnosed, you know, I don't think we wanna give you that diagnosis. I don't want that diagnosis.
I can do a lot more than the water than I can.
Yeah, what you call it, just schedule one of the procedures, please. Find out if that's about dealing with sensitivity.
Really get my feet under me, like.
And it took her 3 years after that, to find out she had raging failure.
Well, that's what
I see, I'm looking back when I saw that on the list, I was like,
like, there's one exercise she can do now, but she doesn't my balance on that. Because if I was to ever be pulled over in the middle of the night, and they were to do the foot thing, I'd be like, no, sorry, I can't do it. Just do breathalyzer, because I can't do it. So.